All right, welcome everyone to our Moving with MS presentation support group. I'm really excited because this month we're talking about bowel and bladder function and a little bit of sexual dysfunction in multiple sclerosis. And I think this topic is so necessary and not talked about often enough. It's often one of those symptoms that people with MS might be experiencing, but are too embarrassed to mention to their doctors, and also doctors might be too embarrassed to ask you about them. So we're going to review lots of different things today, including different diagnoses, different symptoms and things that can happen with our pelvic floor, urinary and bowel and sexual dysfunction, and we're going to review some exercises as well. So thank you for being here, and a huge thank you to Viatris, who is our supporter for our Moving with MS virtual support groups each month. All right, so we're talking about bowel and bladder function in multiple sclerosis. And what I almost titled this presentation in this support group tonight, instead of bowel and bladder, was pelvic floor in multiple sclerosis. But I realized that not everyone knows exactly what the pelvic floor is, but most people know what bowel function and bladder function is, and it's all related. So I went with that instead. So there's four main things that we're going to discuss tonight. Number one is types of pelvic floor conditions. So these are things like types of urinary or bladder conditions and types of bowel conditions, management guidelines, sexual dysfunction, and then exercises. So first and foremost, I always find it very interesting to know, when possible, because we don't always have this information, but to know where symptoms are coming from. And maybe it's just me, but if you're interested in this as well, then this slide will be very helpful for you. But as you know, when you have multiple sclerosis, the reason that you have most of your symptoms is due to demyelination and/or scars or lesions in specific areas of your brain, spinal cord, or optic nerve. And sometimes we don't know exactly which lesions and which locations are causing certain symptoms. But when it comes to bowel and bladder symptoms, we actually do know. So urinary symptoms, which we'll get into in a second here, those are things that affect our bladder, our urination. Those symptoms specifically come from lesions in a part of our brain called the pons and a part of the brain called the midbrain, and demyelination in our sacral area. So the sacrum is the furthest point of our spine down low, and so it ends at the tailbone, but that bottom part is our sacral area. So there might be demyelination in the spinal cord down in the sacral area, or the sacrum, and/or lesions in the pons or midbrain. Whereas bowel symptoms, so having a bowel movement, whether that's constipation or the opposite, diarrhea or anything in between, that has been shown to be associated with demyelination of the frontal lobe, which is actually up here in our brain, this front part of our brain. So I just find that interesting, of the locations that your lesions or demyelination might be if you have the symptoms that we'll be talking about today. And why do we need to talk about this? Lots of reasons. First and foremost, because sometimes there are exercises you can do. There are medications that you can take. There are management techniques that can help. So if you're having these symptoms, sometimes you don't have to suffer with them. You can start implementing some of these management techniques. But also, a huge reason why me as a physical therapist needs to talk about this more often is because having urinary or bowel symptoms, things like urgency and having to go really quick or really frequent, it puts you at a higher risk for falls. And if you're at a higher risk for falls, then that typically means you're at a higher safety risk. So you're more likely to injure yourself because you're going to quickly try to get to the bathroom, because if you don't get there fast enough, you're going to pee your pants, or you're going to poop your pants, or something's going to happen. So we need to talk about management in this area for lots of reasons, but one of those to help improve your safety with mobility. Okay. And I see a question that came in. Debbie said, how would it be known if lesions are in the sacrum since MRIs are only for cervical and thoracic? I would wonder if you'd have to specifically ask for an MRI of the lumbar and sacral region, because you're right. Normally, MRIs just look at the brain as well as the cervical and thoracic region. So I bet you'd have to specifically ask for that, but good question. Okay, so starting off with urinary and bladder conditions, and if you feel comfortable, I'd highly encourage you to type in the chat and let me know. No one else can see what you're typing, it's just me that can see it. But let me know which of these symptoms that you've experienced. So, and these are just some. There are lots, but these are some of the most common ones. So these 4 are urinary symptoms that are typically due to weakness or tightness of the pelvic floor muscles. And before we go any further, but when I say pelvic floor, typically what I mean, if you were to take your hand and sit on it, so you put your hand between your legs and sit on it, pretty much everything that's touching your hand is your pelvic floor. So it goes all the way from our rectum all the way up to the very front. So front to back, that's what our pelvic floor is. And just like any other part of our body, there's so many muscles there. There's lots of nerves that go to that area. And there's a few different things that can cause urinary and bladder conditions. The ones on this page are mostly due to weakness or tightness. That could be MS related or not. But let's dive in. So the first one is urgency. So urgency is the sense of having to go pee, having to urinate right away and often unexpectedly. So urgency would be you and I are having a conversation right now, and out of nowhere you say, hold that thought, I need to go to the bathroom right now or I'm going to pee my pants. So it's very urgent. Next one is frequency. This is super common. So this is frequent urges to urinate. So basically, you're not just going to the bathroom a few times a day, you're going 10 to 20 times a day. So you're going really frequent. That is more urinary frequency versus urinary urgency. Another one is hesitation. So this is when you have difficulty starting your stream. So difficulty starting the urination, whereas retention is difficulty fully letting it go. So they're kind of opposites in that way. With hesitancy, you have difficulty starting or maintaining. You might notice you can start the stream, but then it stops, and it starts again, but then it stops. So that can be hesitancy as well. Whereas retention, you can't fully eliminate all of the urine that you have in your system. And that can often lead to urinary tract infection. So none of these are great. One that's not listed here that I do want to talk about though is one that is nicknamed, it's a type of urgency, and it's nicknamed key in door. Literally when you put a key in the door and you feel like, oh my gosh, I need to go to the bathroom. And this is actually more of a negative habit than it has to do with weakness or tightness. And so you've experienced this if every time you get home you have to run to the bathroom. Or it could even be associated with turning water on. If you hear water from a sink, from the laundry, if you just hear water, you have to go to the bathroom. Your brain associates hearing water or putting the key in the door, it associates an action or something that you see or hear with urgency. And so that has a different approach to treatment because it's not necessarily due to weakness or tightness, it's more due to habits that have been built. But these are the most common urinary types of symptoms that you might see. I'm just going to look in the chat to see what you guys have mentioned. FYI, I have asked and doctors said MS protocol doesn't cover lumbar and sacrum. My specialist couldn't order it. Yeah. I experience all of them except for retention, urgency, and frequency. I had all those bladder conditions until trying one of the scripts improve the quality of my life, and I don't take a lot of MS drugs. That's awesome. Urgency and frequency. So I've experienced each of these. I would literally run down the hall from my office and then couldn't go. Yeah, so that's more of that hesitancy and retention potentially. I have peed outside by the door multiple times. Yeah, I have a suprapubic catheter and hard to go number 2. Yep. Urgency, sometimes hesitant. So urgency seems like the number 1 here. Urgency may be followed by frequency. Absolutely similar to key and door. Once I drive into the garage and put my feet on the floor, I can't get to the bathroom fast enough. Yep. It's a crazy dichotomy to have urgency and retention. Absolutely. Yeah. Okay. So, and thank you for sharing that, by the way. So again, those that we just reviewed are more so due to weakness or tightness in the pelvic floor, excuse me, which again can be caused from MS. Your demyelination, your lesions could cause weakness in the neural pathways that go from your brain down to your pelvic floor. However, there's also this other special type of urinary symptom, we'll call it, which is neurogenic bladder. And this is when the nerves that carry the messages back and forth between your brain to your bladder and the spinal cord and that whole pathway, they don't work the way that they should. So it's not the same as, let's just say, hip flexor weakness, where it's there, but you can, like, the weakness is there, but you can still use your muscles. It's just weaker. With this, with neurogenic bladder, the whole pathway from your brain down the spinal cord down to your pelvic floor is just misfiring. It's the wrong signals. It's almost like, it's similar symptom potentially could be temperature misregulation, where it's freezing outside. It could be the dead of winter, freezing, and you're sweating. Your brain is getting the message for some reason, these misfiring signals, that you're hot. And so you start sweating even though everyone around you is freezing their butts off, or vice versa. That's another example of when there's just misfiring. It's wrong. Your brain is interpreting wrong signals. That's what neurogenic bladder is. Your brain is getting the message of, oh my gosh, you're going to pee your pants, go to the bathroom right away, even though your bladder is not full. So again, that's a different reasoning, and the reason I want to harp on that a bit is because it's different forms of treatment. It's different types of management. So symptoms, though, could be pretty similar. You could still have urinary leakage or urine leakage, urinary tract infections, retention, kidney damage or infection, depending on how long this has been happening. The treatment for neurogenic bladder is typically urinary catheters, antibiotics to reduce the chance of infection, and in severe cases, surgery. We'll get to treatments for the ones on the previous page in a second, but I just wanted to point out this one because this one is different. And someone says incontinence and retention. Yeah, so I do just want to go back to this slide for a second and just let you know that all of these are considered a type of incontinence. So urinary incontinence is this big umbrella term. And then these are the types of urinary incontinence. So if you have any of these, what might be written in your doctor's notes is so-and-so has urinary incontinence. But it's really important, I think, to know which type of incontinence you're experiencing. And so these are the most common different options. Okay, so yes, self-catheterization is also a life changer. Yeah, that's definitely an option as well. Again, there's lots of different ways to manage. I'm just kind of reviewing some of the most common ones, but self-catheterization for sure. And someone actually is asking, so the treatment would not be pelvic floor therapy, or is that beyond a pelvic floor PT interventions? So for neurogenic bladder, typically pelvic floor physical therapy, it can still be helpful. if you have neurogenic bladder and one of these other types of urinary symptoms. It absolutely can be both. I should have said that a little bit earlier. So pelvic floor physical therapy, obviously I'm biased, not that I'm a pelvic floor physical therapist, but pelvic floor physical therapists are so amazing. I would highly recommend finding one near you, but you can have both. So oftentimes with neurogenic bladder, what typically happens is you would go to pelvic floor PT. You would work on whatever they feel is best for you, whether it's strengthening exercises, stretching exercises, or both. And then you see how you feel. How did you manage that? Did your symptoms improve, but only up to a certain amount? Did they not improve at all? And then you go to the next type of treatment that you'd want to improve, or next type of treatment you'd want to, what's the word I want to use? Implement, because there's lots of different options. But typically neurogenic bladder, you would go to PT still, pelvic floor PT. You would probably notice some level of improvement, but it wouldn't fix everything. You would still have your symptoms and you would need to add on something else. Pelvic floor physical therapy changed my life. Stress happens and then puts me back at square one with frequency. Yeah, and another type of incontinence is stress incontinence. So that's one we didn't really talk about here. It's not as associated with MS in particular, but stress incontinence is when you have stress on your pelvic floor and that causes your incontinence. So it's sneezing, laughing, walking fast, jogging. It also literally could be mental stress in some cases. Typically it's stress on the pelvic floor, but that's a different type of incontinence. So there's lots of different things that are happening that pelvic floor physical therapy can help with. Okay, so general guidelines, and these are things that can help with any type of pelvic floor, would be first and foremost, and I cannot stress this enough, I should have bolded this one, adequate fluid intake. Oh, so often when my patients struggle with any of the things that we've talked about so far, the first thing they do is they stop drinking water. Let me know in the chat if you stopped drinking water, or at the very least, reduced your water intake. Also the stresses that raise blood pressure, yeah. So reducing your fluid intake and eliminating your fluid intake is one of the worst things that you can do. Having or being hydrated helps your bladder function the way that it's supposed to. Being dehydrated makes things worse. But I understand that this can be a concept that seems backwards. It's almost the same as fatigue. Like if you're fatigued, like really fatigued from MS, like experiencing MS fatigue, you might assume, well, I shouldn't exercise. But exercise actually can make fatigue better. Same thing here. If you're having urinary symptoms, frequency, urgency, any of them, you might think, okay, let me stop having water. But having water actually helps. And so, yeah, I see a few people saying guilty, they reduce their intake. Yeah. My pelvic floor PT says that sipping water increases the desire to drink and says don't sip. When I first started working with her, she suggested keeping a drinking log and drink 6 to 8 ounces every 2 hours. Yeah, so it's highly important that you stay hydrated. Being dehydrated will make any urinary and bowel symptoms worse. So even if you do reduce it, reducing can be okay depending on how much water you were having or fluid in general, but you have to keep drinking. Generally speaking, they say to have half of your body weight in ounces. So if you weighed 200 pounds, you would have 100 ounces per day. If that feels like too much for you, start at 10 ounces. If you're truly having no water or no liquids because of this symptom, start really small and then work your way up from there. There's also been research showing that the speed that you ingest liquids is associated with the speed that you eliminate them. So if you are, let's say you have a goal of just picking random numbers off the top of my head. Let's say your plan is that 5 times a day, you're going to drink 10 ounces of water. and you just chug the 10 ounces just to get it over with, right? There's research showing that if you chug 10 ounces of water, you're going to be running to the bathroom because you drink it so fast that eventually you're going to have to quickly urinate it. Whereas sipping water can be a strategy where if it's slow and controlled throughout the day, then your urination will also be slow and controlled. Now, everyone is different, so this research might be true for some people, not true for others. It's always worth testing it out and seeing what truly works for you. But if you feel like you're the type of person where if you chug water, you're going to be running to the bathroom, well, then don't chug it. Have tiny sips throughout the day and see if that works better for you. Again, limiting fluid and or eliminating fluid is harmful. Avoid or minimize bladder irritants, things like caffeine, aspartame, alcohol, and smoking. Timed avoiding is when you purposely build in times throughout your day to urinate. And this is especially helpful if you have, well, really any of the types of urinary symptoms, but especially if you have difficulty with hesitancy or retention. If you build a time to go to the bathroom, your brain can establish a habit of, okay, it's 10 a.m., I'm gonna go pee right now. And now it's 2 p.m., I'm gonna go to the bathroom right now. And so timed voiding can be something that you implement. And then hot baths can also be something that works. I see Debbie says, after trying so many supplements, meds, therapy, no dairy, etc. for UTI, what I found to work best is Eucora. Interesting. Over-the-counter daily protocol regimen and a game changer. Very cool. Thank you for sharing that. I will share that in the chat for everyone to see how that's spelled. I recently increased my water intake. Awesome. I stopped with 1 to 2 tablespoons of apple cider vinegar in a glass of water. Had caused me to feel urgency. Turned out it caused urine to be extremely acidic. Yeah, absolutely. And acidic things can make, I didn't put it here, but acidic things are bladder irritants. I have a patient who used to have, it was like a clementine, I think it was a clementine, every single night before bed, and she constantly felt urgency within an hour or so of going to bed. She stopped having the clementine and it made a huge difference. My fiance is hearing and chimed in that sipping allows it to be absorbed better. Yeah, absolutely. Dr. Gretchen, you are an incredible blessing. Thank you. You're welcome. Good to know. Yeah, I'll put the link. Thank you for sharing that, Debbie. Okay, awesome. What time have we got here? I want to make sure I'm staying on track. Okay. So as we mentioned, let me back up. These were just bladder guidelines, like general healthy things that we should all be doing. But sometimes it does require more than that. So some urinary medications or surgeries might be, well, pelvic floor physical therapy would be the next step, but I'm going to say that till the end. The other options might be medications or surgeries. So some medications that potentially might be prescribed for you is to treat a urinary tract infection, first and foremost. Anticholinergics, which are especially helpful for overactive bladders. And then muscle relaxers if your pelvic floor is too tight and maybe you're not responding at first to pelvic floor physical therapy. Maybe it's more spasticity related. So there's several different types of medications that you might be prescribed, usually by your neurologist. Estrogen inserts, self-catheterization, stimulation devices, and then of course, pelvic floor physical therapy. So these are options, again, where normally your neurologist would discuss these with you. If they immediately go here, I would highly suggest you asking about pelvic floor physical therapy. To be honest, and I'm curious if you knew that there were physical therapists that specialized in pelvic floor. Let me say yes or no in the comments or in the chat box, just so I know, because I will say most people don't know, including doctors, don't know that there are pelvic floor specialized physical therapists. Just how I'm specialized in multiple sclerosis, there's whole trainings and certifications and programs for pelvic floor. And it's well, I shouldn't say completely different type, but it's a unique, individualized, specialized type of physical therapy that regular traditional physical therapists don't normally work with. And so they do exist. Yes, a bunch of you saying yes. Good, good, good. I will say not a lot of people don't know that they exist, including doctors. So if they don't mention it, if they immediately go to medications or surgeries, ask, can you write me a referral for pelvic floor physical therapy? I see someone says, not until others with MS informed me. I learned from my urologist and neurologist. Awesome. Oh, this makes me so happy. I opted for PT instead of meds. Good, good, good. Okay. Oh, I feel like I can take a big sigh of relief. Yes, so good. I'm glad that you guys are aware of it. Hopefully your doctors are too, but if not, advocate for yourself that pelvic floor physical therapy for anything we're talking about today, pelvic floor PT should always be something that you're doing potentially in addition to something else, or at least on its own. Okay. So moving on to, and we'll get back to pelvic floor PT at the end with types of exercises, but bowel conditions. I wanted to mention these because bowel is also part of our pelvic floor. Remember, if we sit on our hand, we're touching our bowel area. So the most common, according to MS research, the most common bowel dysfunction, bowel symptom is constipation. And the number one reason that people have constipation is due to dehydration from bladder dysfunction. So if you had any of those bladder symptoms, and all of you guys that said, yes, I have less water, or I eliminated drinking water or liquids, fluids in general, that causes constipation. So it also could be other things, as I've listed here. Maybe it doesn't have anything to do with bladder dysfunction, or it's bladder dysfunction and one of these other things. So inadequate neuro-GI signaling, which again is what I mentioned earlier of the signaling from your brain all the way down the spinal cord down to all of the muscles in the pelvic floor is just misfiring. Or your muscles can't relax, and so it can cause constipation and or decreased abdominal tone. I will say I have a few experiences with different clients with multiple sclerosis where they didn't even tell me that they were experiencing bowel symptoms. They didn't mention it at all, but for other reasons, we started working on core strength and abdominal tone, abdominal strengthening, breathing exercises. And just from that alone, after a few weeks, they reported back saying, I didn't tell you this in the beginning because I was embarrassed, but I was really constipated, or I was having, XYZ bowel conditions, and it's getting better. And it was because we focused on the core. And so decreased abdominal tone can also have bowel dysfunction as well. So other examples of bowel dysfunction related to MS could be very similar to urinary. So incontinence is the umbrella term, but urgency, hesitation, constipation, or diarrhea. Let's see. Pushing or holding heavy objects makes me feel urgent. Yeah. My urologist recommended over-the-counter azo cranberry gel caps for UTI. 6 months later, all is good. That's awesome. I believe whoever invented the poop emoji has MS. Can't make this stuff up. And then Mary Lou says, I take Tropium for overactive bladder. That's good to know. I'll put that one in the chat in case anyone wants to look into that. Okay. And I'm curious too, of those that are on, I know some people will be just watching the recording, but of those on, do you have bowel symptoms as well, or just bladder? So I'll wait for those to come in, but I'll keep moving on. So bowel guidelines, kind of similar to our urinary guidelines. Number one, I'm going to skip to the third one here, drinking fluid, just making sure that you are staying hydrated. Not only will that help your bladder, but it will also help your bowels, whether you're constipated or diarrhea, just keeping a normal level of hydration is going to be helpful. Then going back up to the top, eating more fiber, so fruits, vegetables, beans, eating breakfast. So often when people are constipated, For some reason, we avoid breakfast, but breakfast morning time is when our bowels are most active. And so we really want to utilize that. And so especially if you're someone who likes to fast, you might want to choose the times of day that you're eating to be earlier in the day, because our bowels typically slow down as the day goes on. So you would want to eat more in the early parts of your day to allow your bowels to work and get rid of the waste and anything it doesn't need to keep. Massage. So there's abdominal massage that you can do. The I love you, we'll go over that later. But you can literally massage your abdomen in a specific way to get your bowels moving a bit quicker, a bit better. Adjusting your medication regimens that might be contributing, because medications can sometimes cause bladder and bowel dysfunction. So just reviewing what medications you're on with your doctors, with your neurologist, psychiatrist, is that the one that reviews medications? I'm blanking. Making sure that your meds aren't contributing, and if they are, what can we do to tweak them? Performing regular physical activity. If you are sitting a lot of the day, most of the day, that can cause your bowels to go haywire. And a good goal to have for a comfortable bowel movement, ideally, is either every day, every other day, or every 2 to 3 days. Everyone's going to be a bit different, and so it would be unfair to say everyone should be going at least once a day. That's just not normal for some people, and you'll know, like even before MS, you might say, I've only ever gone 2 to 3 times, or like every 2 to 3 days, like twice a week or 3 days a week. So everyone is going to be different. But for regular bowel movements, you need about 1.5 to 2 quarts of fluid per day and 20 to 30 grams of fiber per day, and activity. Activity can just be walking around your home. It doesn't need to be going on a treadmill or going for a run or anything crazy. It could be walking around your home. It could be standing up and sitting down. It could be whatever movement is feasible for you. And I do see, I asked if you guys had bowel and bladder, or just bladder, just bowel symptoms. I see a bunch of people saying both. Terrible constipation a lot of the time. One thing I do want to mention before we move on is eating more fiber. For some people, that is just a game changer. You eat more fiber and bam, you don't have constipation anymore. But for other people, you need to eat more fiber with a lot of water. Otherwise, fiber can actually constipate you even more. So being on the lookout for that, knowing what you feel happens to your body when you do have more fiber. Also, I want to say too, for bladder and bowels, we talked about having a healthier diet. Right now we're talking about more fiber. There is a difference between getting supplements and nutrients from supplements versus actual foods. For some people, and I think someone earlier mentioned they started a specific supplement and it worked great for them. So for eating more fiber, it could be like, I think it's Metamucil, is something that you can add to, do you drink it? I think you drink it. For some people that works great, for other people it doesn't. And your fiber actually needs to come from real foods like chia seed pudding, or eating more fruits that have fiber. Like the supplements don't have the same effect as actual foods like beans and stuff that have fiber. So again, it's all about getting to know what works for you and your body. Bowel and bladder, both. Okay, so a lot of people saying they have both bowel and bladder. A few times recently since I started drinking coffee to combat fatigue. Ugh. Urinary hesitation happens more when I am constipated. Yeah. I first called urinary problem. Now I have bowel problems. I'm hoping to get that under control. Yeah. Nutritionist for medical review. Yeah, absolutely. Nutrition plays such a role in our pelvic floor and our bowel and bladder function. That would be a good referral to get. Organic popcorn works wonders too. I just have to limit to 1/2 ounce at a time. Ooh, that's cool. Bladder overactive at night. I experienced both, and the bowel has happened a few times since I started drinking coffee. Oh, right, I mentioned that one. Ground flaxseed, also good for fiber. Absolutely. Yeah, there's lots of things that are really good for fiber intake if you feel like you need to use that. And then again, there's also medications for bowel symptoms with MS, and it depends on what symptom you're having. So anti-diarrheal obviously would be if you're having diarrhea, so the opposite of constipation, or laxatives. Bowel retraining is very similar to with urinary. We talked about timed voiding, and timing when you're going to urinate. For bowel management, it's called timed emptying. So again, you set specific times. Maybe every morning at 9:30, you're going to go into the bathroom and plan to have a bowel movement. It might not happen at first right away, but you train over time. You train your brain that you're going to go to the bathroom at these specific times, and that's when you're going to urinate or have your bowel movement. And the goal is that eventually your brain will understand, okay, it's this time, I'm going to go to the bathroom. I was just watching, I can't remember what it was. I feel like I was just watching a TV show, or maybe it was a movie or something. And in there was this guy, and he is in a car with someone, and he says, oh, it's, whatever time it was 1 o'clock. I got to go to the bathroom. But they were driving somewhere, and the guy was like, well, I'm not pulling over. We're almost at our stop. And it was this whole situation, but it's because he had basically what he was talking about, not that this was mentioned, it was not about MS, is that he had timed emptying. Every day at 1 o'clock, he'd go to the bathroom. And if he didn't go to the bathroom at 1, it was an urgent situation. So timed emptying can be really helpful. Surgery to repair damaged muscles or electrical stimulation. Again, there's lots of different options. It's really going to boil down to what makes the most sense for you. And one that I forgot to put on here, but should have put on here, is, again, pelvic floor physical therapy. Probably Sheldon on the Big Bang Theory. Maybe it was. Okay, how are we doing on time? Not too bad. So I just quickly wanted to touch on sexual dysfunction because, again, it's part of our pelvic floor. And then I do want to get to some exercises as well. So sexual dysfunction occurs in 62 to 83% of people with MS. Even on the low end, that's over half of people with multiple sclerosis. That is a lot. And I'm curious, again, no one else can see this but me, but let me know in the chat box if you feel like you've ever experienced any type of sexual dysfunction, potentially due to multiple sclerosis. And this could be, there's so many MS symptoms that can affect our sexual dysfunction, not even to mention the pelvic floor stuff. Like, if you have tightness or weakness from MS, that can of course affect your pelvic floor, as we've been discussing this whole time, but fatigue can also affect your pelvic floor and your sexual life, sexual dysfunction. Spasticity, if you have a lot of tightness in your pelvic floor, that's going to make it really challenging to have an enjoyable sex life. Pain, again, that is not going to be enjoyable. Bowel and bladder dysfunction, mood disorders. There's so many things that can cause sexual dysfunction, specifically in multiple sclerosis, whether it's related to MS specifically, like the misfiring, or if it's related to one of the other symptoms from MS, like MS caused tightness or spasticity, and now it really hurts to open my legs. And the same for even going to the bathroom, opening your legs wide enough to wipe can be challenging and painful for some people. So it's important to know that it's all connected. And again, pelvic floor physical therapy can help. This is not an ad for pelvic floor PT. I feel like I constantly mention it. But again, pelvic floor PT can help with bladder, bowel, and sexual dysfunction. And one thing that I did put here was try stretching before you have sex. So if you are someone who feels like you have like sex is painful, if it feels like a lot of pressure, again, of course, pelvic floor PT would be able to do an assessment and tell you what to actually do. But sometimes stretching before can make a world of a difference. So especially if you have a discussion before and it's not just impromptu sex, if you discuss, on this day we're going to have sex, or hey, later today, do you want to have sex? Like if you have those conversations, then you can prepare maybe 20 minutes before you're going to do some stretches, and maybe it's like with inner thigh stretches or hip stretches, movements that can help relax the pelvic floor. I have several patients who have done that, and they've said it made a world of a difference. Pain and light bleeding tied with menopause. True, that we're not even talking about menopause, and you add menopause into all of this. That definitely adds in some other factors. How are we defining sexual dysfunction? Decreased sensitivity or pain. Anything that is less than ideal is considered sexual dysfunction. It could be sensitivity, it could be pain, it could be lack of sensation or hypersensation. It could be fatigue, stamina. It could be anything. Pain before I was diagnosed. Yeah, MS has definitely affected sexual dysfunction. I basically don't have sex because it hurts with my catheter. Yep. Or I have pap smears. Right. It doesn't always have to be actual sex. I'm a female with delayed orgasm, even though I'm stimulated. Yep. Yeah. Yes. It can affect so many areas. Okay. So just a few slides. We're making decent time. A few slides left. So I wanted to go over some exercises. Yeah, someone says I experienced lack of sensation. Yep, vaginal dryness. Yeah. So pelvic floor physical or physiotherapists are trained to evaluate and treat your pelvic floor condition. And so I think it's important to mention, if you do go to a pelvic floor physical therapist, one thing that's always optional, but if you're comfortable, I would highly, highly recommend you do it. But the thing that's optional is the internal evaluation. So basically, they will insert, usually it's one finger, into any area, it could be bowel or bladder, to assess your tightness or oh my gosh, what's the opposite? Looseness. I can't think of what the opposite word of tightness is, but tightness, or the opposite of weakness or tension. They can assess that with an internal evaluation, which is so helpful. Without actually feeling it, it can be hard to assume what's going on. Now it's optional, it's not necessary. They are able to do other tests and just see how tight are your hip muscles, what is your core strength like, and those other things can sometimes give an idea of what might be happening with your pelvic floor. So if you're not comfortable with that, still go. It is still going to be beneficial. It's just that they can get even more accurate information with the internal evaluation piece of it. That piece of it probably takes maybe 5 to 10 minutes max. So it's definitely not like they're going to have a finger in you for the full hour-long evaluation. It's just a small piece of the evaluation that can be helpful. But they do that so that they know what's going on down there. We got to know. Okay, so these are some of the exercises that we're going to review. I'm going to stop sharing my screen just so you can see me a little bit bigger. And I'm going to demonstrate all but one of these. And is there anything else? Let me see. Yeah, so that's all. Here's my slide if you ever need to get a hold of me. This is my missing link, my website, if you want to find other ways where you can work with me. I've got a Facebook page, Instagram, podcast, YouTube. I keep forgetting to put my book on here, but I've got my book that is called The Missing Link as well. And it's also now an audiobook if you prefer listening versus reading. Okay, so I'm going to stop sharing my slides. We'll go over those exercises. And then if you guys have any further questions. I see Dr. Erin Boster recommends adult vibrating toys. Yeah, absolutely. So the first exercise, and we're just going to do, because of the time, we don't have time to do like a full class right now. So I'm just going to do a demonstration, but feel free to do these right along with me because they can be really helpful. So the first one is diaphragmatic breathing. And this helps a ton with control. It helps with our abdominal strength, actually. It helps with our pelvic floor strengthening and releasing. We can combine it with Kegels. A lot of people assume that they either have tight or weak pelvic floors. when in reality it might actually be the opposite, or it might be both. And so I always, when I do Kegels, I like to focus on the tightening just as much as the relaxing. So often when we think of Kegels, or Kegels, some people call them, we just think of this: squeeze your pelvic floor, hold, and then let go. But it's so much more than that, and it shouldn't. Some people shouldn't do the squeezing part because you might be too tight anyways, especially if you have spasticity. So anyways, let's get to diaphragmatic breathing. I'm going to back up here. So I am 9 months pregnant as of tomorrow. So this is going to look a little bit different on me than it will on you, but you'll still get the idea. So for diaphragmatic breathing, it's also called belly breathing. You're going to sit up tall and you're going to place your hands on your belly. So I like to think of putting my index fingers on my belly button, and then your other fingers just rest wherever it feels comfortable for you. And as you inhale through your nose, your belly expands, and not just your belly here, but think of everything around here, like even your sides should come out. Basically, you're trying to inhale and you expand here, not up here. So it wouldn't be, so you're not breathing with your chest. So it's an inhale and your belly comes out. Exhale and your belly goes in. Inhale, belly goes out. Exhale, belly goes in. Let me show you from the front. Because I am pregnant, it's nice that you can see a little bit more clearly what's happening. So, because watch where my fingers are touching. So they're touching now, or at least like these two are. When I inhale, because my belly is expanding, it's going to separate. So inhale, belly goes out. And I'm not opening my hands, it's just because my belly opened. And then exhale, belly goes in. So it's a practice. I recently did this with one of my patients, and it was the first time she'd ever learned it, and she was like, I can't do that. I have no idea what you're talking about. And she was just breathing with her chest. So it takes some getting used to, but that would be belly breathing. Now we can combine that with Kegels. And so if you think about when you breathe in, your belly comes out and your pelvic floor lowers. You just release your pelvic floor, let everything go. So it'd be breathing in, belly goes out, pelvic floor drops. And then as you exhale, belly comes in and you lift your pelvic floor up. Breathe in, breathe out. So this is a pretty advanced exercise where you're focusing on the belly and the Kegels, but that's one option that you have that can help with urinary and bowel function. Let me get back to see what the next one was. The next one I wanted to review with you was a ball squeeze and bridging. But instead of bridging, because I can't get down to the floor and then back up as easily these days, I'm going to do a different one. But basically, it's hip strengthening. And so a ball squeeze, which I don't have a ball, it doesn't have to be a ball, it can be your hands. What you would do is you put your hands in a fist. You're not squeezing too hard, just put your hands in a fist, put them together, and put them between your knees. You're still keeping good posture. So you'll see my back is still flat. I'm not rounding like this. So flat back, but your hands are between your knees, and you're gonna squeeze your hands together and then relax and squeeze in and relax. The stronger your hips are and the more flexible your hips are, the better your pelvic floor will be. Our pelvic floor, again, you put your hand down here, everything that's touching your hand is part of your pelvic floor. So many, if not all of the pelvic floor muscles attach somewhere on our hips. So if our hips are really tight, our pelvic floor is probably really tight. If our hips are really weak, our pelvic floor is probably really weak. So this is one strengthening exercise that can strengthen the inner hips and therefore the pelvic floor. So you'd squeeze in. We could combine this with a Kegel as well. So when you squeeze in, you're also picking up your pelvic floor. You're lifting your pelvic floor up. And then when you relax, your pelvic floor relaxes. And then squeeze in and you can lift your pelvic floor. That's the advanced version. And then relax and let the pelvic floor relax too. The other option, or not another option, another exercise would be one of, if you're in the missing link, I know some of you guys are, you know this one, my seated clamshell. So you're sitting with your feet together and your knees touching. You're gonna open your knees as wide as you can without your feet rolling away from each other, and squeeze your glutes so that you're supposed to be activating your butt muscles here. Hold, 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 relax your glutes and close. And then open. So this one, you're strengthening the outside of your hips, which can have an effect on strengthening your pelvic floor. Again, we can combine this with our Kegels. So as you open and squeeze your glutes, you're picking up your pelvic floor. As you relax, you're relaxing your pelvic floor. So if you open and lift, relax and lower. Another one that I want to move on to before stretching, I mentioned earlier, is the I love you massage. So this is more for constipation, but you want to start over on your right hand side down here, and you're going to come up. So you're making the letter I, and you can do this about 10 times, or if you want to time yourself, maybe 1 minute or so. So that would be the I, and then then you do an L, so I-L. So this would be an L, it's an upside down L. And you would do that, it could be as little as 10 times or up to a minute or so. And you're picking your hands up each time. So you're always starting down here, then going over. Once you've done that, it's a U, I-L-U, so I love you. So the U is you start down here, up, over, down. Move your hands up, over, down. And this is something you could do daily, if not multiple times throughout the day. But essentially, you're following your intestines to get things moving. If your bowels are blocked or stuck, this is an I love you or ILU massage that can get things moving. Okay, the last thing that I wanted to show you, 2 stretches. One is an inner thigh stretch. I mentioned this one earlier. So you open your feet and knees as wide as you can. They should be in good alignment. You shouldn't have knee kissing. If this is as far as your knees can go apart, then move your feet so that they're in the same alignment. I wouldn't want anyone's knees looking too far in. But get them as wide as you can and push open. You don't feel much there, you can hinge forward and keep pushing open. As I mentioned, the tighter your hips and thighs are, the tighter your pelvic floor is. So opening your pelvic floor, opening your thighs, your adductors can be really helpful. So this is another really good one. And while you're here, if you are someone who has a lot of tightness in your pelvic floor might be tight right now and you didn't even realize it. So while you're here, relax your pelvic floor. Think about lowering your pelvic floor. And then you can come back up. And then the last one I want to show you is a stretch for the outer thighs. Again, if your outer thighs, outer hips are tight, your pelvic floor could be tight. So you're gonna grab your leg, don't mind my comfy slippers, and you sit up tall. For some people, this is enough of a stretch, and you'll feel that stretch right over here in that outer hip. For other people, that's not enough of a stretch, and you'll have to hinge forward. So you do you should feel some type of stretch on the outer hip, maybe even the outer thigh. But again, your hip muscles are so intensely correlated to your pelvic floor that if we can loosen the hip muscles, then you're more likely to loosen your pelvic floor as well, which, as you can imagine, is going to be important if you have a lot of tightness in the pelvic floor. So those are just a few of exercises that you could do. There's tons, and again, I would highly recommend that you see a pelvic floor physical therapist to actually evaluate you and diagnose you. It's really hard to tell yourself what is going on without an evaluation. So many people assume that they just have weakness, especially if you have urinary urgency or frequency, you might have just assumed that you have weakness and that's why you got to go all the time. But those symptoms can also happen from tightness and vice versa. So I just think it's so important to get tested, see what actually is happening for you. And now let me get back to here. Okay, is this information in your book? Yes, I do actually talk about pelvic floor physical therapy and pelvic floor exercises and demonstrations in my book. And do I have it here? Yeah. I actually do have demonstrations, pictures of the pictures of the exercises as well. I can't remember exactly what, it might be in chapter 2. But yes, it is touched on in my book. Picking up a blueberry, yeah. Pam is referring to Haley Kava. She's a pelvic floor physical therapist that I absolutely love. And when she's talking about doing Kegels, she mentions, imagine picking up a blueberry with your pelvic floor. And I love that visualization because so often when we do a Kegel, we just squeeze everything down there. And that's not actually what a Kegel is. You might not be using, you might not be using the correct muscles at all if you're just kind of squeezing everything. So focusing on just a light squeeze, just a blueberry. You don't want to pop the blueberry. Just pick up a light little blueberry. That's all we're going for with the Kegel. You look so beautifully, healthfully pregnant. Thank you, Lori. I appreciate that. Can I see your list again of the exercises? Yeah, let me pull those up. I love to refer to the gentle pelvic contraction as pulling in like a jellyfish. Yeah, helps visualize what's happening down there. Absolutely. The I love you is so helpful. Yeah, for a lot of people, the I love you is really helpful. And if you do find it helpful, I would do that, as I mentioned, at least once a day, if not several times a day. And you could even do it if you're going to plan to do the timed emptying. You could do that 15 minutes or so before your timed emptying just to get things moving. So the ILU or I love you, again, you're starting down below on your right side and you come up, and that's the I. And then the L is up and over. So it's like an upside down L. And then the U is up, over, and down. So you start with the I, it turns into an L, it turns into a U. How about ways to get up off the floor? That's actually in my book as well with pictures. How many I love yous? It's going to be different for everyone. As I mentioned, you could do as few as 10 of the I's and then 10 of the L's, 10 of the U's, or you could set a timer and do just the I for 1 to 3 minutes, then the L for 1 to 3 minutes, and then the U for 1 to 3 minutes. And so it can really be whatever you have time for. Time with you is such a gift. Oh, that's so sweet. Awesome. All right, well, I will let you guys go. Thank you as always. Thank you. Huge thank you for tuning in. I love being able to chat with you guys. I know that I can't see you, but you can see me. And it's just really special to be able to talk to you guys at least once a month and just share my knowledge and educate you guys. So thank you to you guys for joining. Thank you to MSVs and News for choosing me to work with you guys in this way, and also Viatris as our supporter. But have a great rest of your week. Have a great rest of your evening, and I will talk to you guys soon. Bye, everyone.